Hello, my name's Andrew Shepherd. I'm an orthopaedic surgeon in Warwickshire. I'd like to talk to you today about knee replacement surgery and osteoarthritis. What is osteoarthritis? Osteoarthritis is when the lubricant surface of the knee joint becomes worn away. This often happens as we get older and can also be caused by damage to the joint in earlier life. It eventually wears all the way through and exposes the bone underneath, and this can be very painful, and this is often when patients get referred to me. The x-ray on the left shows the difference between a normal knee and a knee with osteoarthritis. The x-ray on the left shows a clear gap between the femur and the tibia. The x-ray on the right shows arthritic features such as narrowing of the joint and bone grinding on bone. What symptoms do you get with knee arthritis? Typically, patients who have osteoarthritis of the knee get an aching felt deep in the joint. It's often worse with activity and improve with rest or simple painkillers. The knee can become stiff, and patients sometimes report that they've lost the full range of movement in the joint. They can get swelling from time to time, and sometimes it feels as if it will give way, particularly if they're going downstairs. As the symptoms worsen, patients often find that the knee keeps them awake at night and their ability to walk reduces more and more. What treatment options have I got? Patients with osteoarthritis of the knee are initially managed with non-surgical treatments such as weight loss, walking aids, physiotherapy and pain-killing medication. Sometimes an injection into the knee with local anaesthetic and steroid is recommended. None of these treatments cure the arthritis, but it's very reasonable to try and mask the symptoms of the disease before considering surgery. Knee replacement surgery. Total knee replacement surgery has been around for about 50 years and it's one of the best operations in the history of medicine. Although it's a routine procedure, it's a big operation and most patients take around 3 months to fully recover. Typically, patients are admitted on the day of surgery and most have a spinal anaesthetic with sedation, and this is where local anaesthetic is injected into the low back so patients can't feel pain in their legs during the procedure. They also have some sedation so they're not aware of the operation. The knee replacement itself is made out of cobalt and chrome metal, and these two metal pieces are cemented onto the ends of the femur and the tibia. A piece of dense plastic is inserted between the two components to act as the new bearing surface of the knee, and sometimes a plastic button is needed to cement onto the back of the kneecap as well. As soon as the knee replacement's been inserted, it's stable enough in the bone for patients to get up and walk around with crutches. Typically, patients go home the next day and use crutches for a week or two whilst the soft tissues are healing. By 6 weeks, most patients no longer need any walking aids and are back to activities such as driving. By 2 to 3 months following the surgery, patients are usually fully recovered and are able to get back to sports or more demanding physical activities.